Good afternoon, everyone. My name is Eleonora Mani. I am the Senior Events Coordinator, in-house interpreter and translator of ISC, Istituto di Scienze Cognitive. And today I am really delighted to be with Dr. Jennifer Sweeton, who is going to teach a two-day workshop next year titled Neural Desensitization and Integration Training, Tools to Integrate EMDR, Somatic, and Other Approaches to Trauma. So Jenny, thank you so much for your time and thank you for being with us today.
Thank you for having me.
So this workshop is going to take place in Milan and it will be held on March 25 and 26, 2023. Well, so the goal of this interview is to allow mental health professionals, especially Italian clinicians, to get to know you better. So I would like to ask you about your background, because I know that you originally trained as a neuroscientist and then also became a clinical and forensic psychologist, specializing in the treatment of trauma and mental health in general, and that you have published 3 books and you have a 4th one coming concerning trauma treatment in general and mental health and mental illness, of course. So can you say more about your background?
Sure. As you said, I originally went to graduate school to become a neuroscientist. And so I started off more in the science realm, more of the research realm. And I studied something called affective neuroscience, which is the study of emotion in the brain. So with that research, was able to look at things like depression. So what does depression look like in the brain, or PTSD? And I became so interested in it that I wanted to begin to then think a little bit more about how we can use neuroscience research to inform the approaches that we're taking in therapy to help clients. And so that's what prompted me to move into more of the clinical realm. So I became a clinical psychologist after being a neuroscientist. And so it's a little bit unconventional in that I think it makes it so that whenever I'm working with a client or utilizing different therapies, I'm thinking about what it is we're actually trying to accomplish in the brain, how we are trying to help facilitate recovery in clients' brains. And so now I'm a clinical psychologist with the neuroscience background. As you said, I also do some forensic work, some legal work where I do evaluations and look at how trauma might be impacting a person's thought process or behavior. And so a lot of the work that I do is really around trauma and PTSD, whether it's clinical work, therapy assessments, or writing or seminars also. So it's a topic that I'm particularly passionate about.
Great, thank you. So I would like to focus now on the model, the specific therapeutic approach that you have developed, which is Neural Desensitization and Integration Training, or NDIT, which is an evidence-informed module-based psychotherapy for PTSD that integrates different elements from EMDR to IFS to CBT, or prolonged exposure therapy. So as NDIT will be also the main focus of the workshop that ISC is going to host in Milan next year, I would be grateful if you could just describe the approach that you have created and how it works, for example.
Absolutely. So as a trauma psychologist, I've always been interested in learning as much as I possibly can about different sorts of therapies or approaches to help clients recover from trauma. I think of the old saying that if all you have is a hammer, then everything looks like a nail. Yeah. And we know that that's not how clients work. And so understanding these different approaches I thought was really important. And through that process over the past several years, I've noticed a couple of challenges that have come up, a couple of problems with some of these evidence-based therapies, which are brilliant and can be very effective. But a particular challenge is that sometimes these therapies are either overly rigid or kind of at the opposite extreme, overly theoretical. So what I was noticing is that some of these evidence-based therapies are very prescriptive. It's very step by step, where there's not really any room for modification or altering the therapies to fit the client, which makes sense actually if you think about it from a research standpoint, because from a research point of view, you actually do need the therapies to be exactly the same in order to compare them. So it makes perfect sense for a researcher, but really for clinicians doing the clinical work day after day, it can be somewhat restraining for us, and it impedes our ability to really be client-centered with our clients. So that was one issue that I saw with some of these therapies. Then on the other extreme, it seems like some of these approaches are very theoretical and definitely rooted in good science, but can sometimes lack any sort of structure. So you might learn the theory and why it's important, and then be a little bit lost in terms of how do we actually make this concrete or turn this into skills that we can use in therapy. And so I created NDIT to be an approach kind of balances these two, that's strongly rooted in theory, but also concrete, but not to a degree that's rigid. So with NDIT, my goal is to teach clinicians new skills, new techniques for processing trauma and recovering from trauma, but in a way that fits with their existing style. So I don't want clinicians to throw out the techniques that they're already using or the modalities that really fit with them, but rather to make NDIT their own. So it's built as being 5 modules, but with a lot of flexibility within each module. I'll say another issue too, that comes up in trauma therapies, and I hear this all the time in seminars, and I've seen it in my own clients, is this risk of re-traumatization when we're doing trauma work where we're focusing directly on the trauma. And so this is, I know, a fear of a lot of therapists, because of course we want to help people, we don't want to hurt people. And so I think it's leading some therapists to kind of pull away from trauma-focused work when I don't think that they need to. So seeing that as an issue, seeing that as a particular challenge with trauma therapies, I wanted to create something with NDIT where there is a slower titration into traumatic material to really reduce overwhelm, destabilization, dissociation, that also incorporates strategies that make recalling traumatic material more tolerable. Because we see with some clients that the second they begin to think of the trauma, they might instantly destabilize. So we want to have extra tools and strategies to try to prevent that from happening. So I'm really excited to present NDIT because it is flexible, it's structured, and I think it provides us with a little bit of a new way of helping clients process traumatic material that's not re-traumatizing or so activating.
Great, wonderful. And I'm sure that clinicians will learn so much during the workshop. And as regards the workshop in Milan, you have mentioned that NDIT is the perfect combination between theory and practice. So can you say more about how the workshop will be structured? Because I guess there will be some theoretical sessions, there will be some practical session, maybe, I don't know, videos, or can you just say more about how the workshop will be structured and what are the main subjects that you are going to explore?
Absolutely. So yes, so I am wanting in the workshop for a part of it to be theoretical, and usually I make theory the beginning part of the workshop, because I think it's important to understand what's going on in the brain in trauma and what it is that we need to help clients heal. So what is the problem? Where are the deficits in the brain? And then what sorts of techniques do we know tend to help those deficits? So starting off with a little bit of basic neuroscience, I don't think you have to be a neuroscientist to understand it, but just a little bit of basic information and tying that to treatment. From that point on, it's going to become more straightforward, more concrete, where we're going to move through each of the 5 modules of NDIT. And those modules are, the first one is concrete skills to help enhance the therapeutic alliance, because we know the therapeutic alliance is so important. And we always say that, but we don't talk a lot about things like mirror neurons or specific strategies that can help attunement. So we're going to focus a little bit on that. Module 2 focuses on helping the clients reconnect with the body, because if you're not in your body and you're not here, there is no regulation that's actually possible. So we're going to talk about titrated, safe ways to help clients reconnect with the body. And then we're going to talk in module 3 about stress response regulation. So managing amygdala activation, managing sympathetic nervous system arousal regulation, and then move into module 4, where we're going to focus a little more on cortical or upper areas of the brain to help clients strengthen their mind with some cognitive skills. Then the area that we're going to spend the most time on is module 5, and that's the actual processing of the trauma. So this is the exposure-based part of the therapy. And we're going to talk about the different ways that clients might be experiencing or re-experiencing trauma, and how to go with the way they're naturally bringing it up in their mind. So we're going to talk about, for instance, how trauma can be processed in terms of images, but we're not going to be tied to that. We can talk about sounds. We can talk about specific sensations that might be tied to the memory, or emotions. And so we're going to talk about these different ways that clients re-experience trauma and how to work naturally with those to help them begin to heal. And we'll be talking about ways to do that that minimize that sense of overwhelm for clients, so that they don't have to be so fearful about facing the traumas. So an example of this is teaching something called psychological distancing skills. And this is where you are going to help the client alter in some way or disrupt in some way the particular images or sounds associated with the trauma to make them more tolerable. So a specific example of this that a lot of clients enjoy, that they like because it does make it more tolerable, is if they're imagining a traumatic image of something. And let's say that traumatic image and that memory is very large and very close to them. A very simple psychological distancing tool would be to have them imagine that they're putting that image far away, maybe on a back wall. And you can even put a piece of paper on the wall and have the client fit the trauma inside that piece of paper. So it's a way of distancing or externalizing the image, which for a lot of clients will make it a lot more tolerable to access, because we know that if you can't access something, then you're not going to be able to process it. So we're going to talk about a lot of tools and techniques for helping clients titrate into and be able to tolerate that traumatic material.
Amazing. Thank you. So just to briefly sum up, what would you say are the main clinical skills that therapists will acquire by attending a workshop like yours?
I want clients, I want clinicians to feel confident when they leave, confident that they're able to move into trauma-focused work without anxiety or fear. Because I think if we're nervous about the work, sometimes we can communicate that indirectly to clients where they think that the work must be dangerous or threatening, and I don't think it has to be. So I want clinicians to feel confident that they understand how to help determine a client's the stress level at any given time, help determine if the client is beginning to destabilize or dissociate, and have a lot of tools in their toolbox to help clients be able to tolerate distressing material through psychological distancing techniques and distraction techniques, stress response management techniques, so that they feel well equipped to be trauma specialists themselves.
Great. I'm sure that participants will gain absolutely helpful insights by attending your workshop. And to close our meeting, our interview, I would like to remind that your workshop will be held in Milan. So it will be possible to attend it in person, but it will also be live streamed So people who may not want or be able to join us in Milan could could follow the event online thanks to the live streaming. And of course, seats will be limited. So if you want to learn more about NDIT and if you want to have the great opportunity to learn directly from Dr. Jennifer Sweeton, you will have to visit our website and sign up for the workshop as soon as possible, as of course, seats are limited. So, Jenny, one last thing that I would like to mention at the end of this interview is that you have also accepted our invitation to give a speech at the Attachment and Trauma Congress, which will be held by ISC next year in Rome from October 6th to October 8th. So I'm really proud and honored to say that you are going to be one of our amazing speakers. And I would like to thank you so much for that on this occasion as well.
Oh, thank you. I'm very excited for both trips to Italy next year.
Great. And I look forward to meeting you in person, of course. So once again,
Definitely.
thank you. Yeah, sorry.
Yes.
Thank you so much, everyone. And I hope that you will join us in Milan for this incredible workshop. Thank you, Jenny. Thank you so much for your time. Thank you.